Picture this. You're sitting in a doctor's office in the United States. Fluorescent lights buzzing above you, that weird paper sheet crinkling under your legs, and you're thinking, I'm just here for a routine checkup. Nothing serious. You feel fine. Maybe a little tired, maybe a little stiff in the mornings, but nothing crazy. You're still going to work, still driving, still living your life. Then the doctor walks in, smiles, friendly, chill vibe, and says something like, let's just run a few tests, just to be safe. And that's the moment. That's the moment your life can quietly split into two timelines. One timeline where you go home, keep living your normal life, maybe make small adjustments. And another timeline where a number on a screen changes everything. Follow-up tests, specialist visits, procedures, medications, side effects, stress you didn't have yesterday. And nobody warned you how fast it can happen. Now listen, I'm not here to bash doctors. Real talk, most of them are doing their best in a system that moves fast, thinks in protocols, and doesn't always slow down to ask the one question that actually matters. Will this test help this specific person or just create more medical noise? Because in America, healthcare is kind of like this massive machine, powerful, advanced, life-saving, but also kind of like a high-speed train that doesn't always stop smoothly once it starts moving. And once you're on it, getting off isn't always easy. Now, there's a concept in medicine that most people never hear about until it hits them personally. It's called the cascade effect, and it's exactly what it sounds like. One small thing leads to another thing, which leads to another thing, and suddenly you're not even dealing with the original issue anymore. You're dealing with the consequences of the investigation. Let me break it down in real-world terms. You go in for a routine scan, just to check. The scan finds a shadow, probably nothing, but they can't ignore it. So now you need another scan. That scan shows something unclear. So now you need a biopsy. The biopsy causes inflammation or complications. Now you need treatment. And suddenly you're sitting there thinking, I came in feeling fine. How did I end up here? That's the part nobody likes talking about. Because modern medicine is amazing at finding things, but finding things and needing to fix things are not always the same thing. And that gap between those two ideas, that's where a lot of older adults get caught, especially in the United States, where preventative care is heavily encouraged. Get screened, get checked, catch it early. Sounds perfect, right? And sometimes it absolutely is. Early detection has saved millions of lives. But here's the twist most people don't hear clearly enough. After a certain age, more testing does not automatically mean better outcomes. In some cases, it just means more labeling, more procedures, and more stress on a body that may not even benefit from the intervention. And yeah, that's uncomfortable to hear. But let's talk real life for a second. Imagine a 72-year-old man. Let's call him Mike. Mike is retired. He plays golf twice a week, fixes stuff around the house, drinks his morning coffee like it's a sacred ritual. He feels good. He goes in for a routine checkup. Doctor says, let's do a stress test, just to be safe. Mike's like, sure, why not? A few days later, results come back abnormal. Now, Mike is not a sick guy. He has zero symptoms, no chest pain, no shortness of breath. He's literally fine. But now the system has a result. And once there's a result, the system doesn't just say, cool, ignore it. It says, we should look deeper. So now Mike is in a cardiology office. Then he's in a catheter lab. Then he's getting procedures. And months later, he's sitting at home thinking, I went in healthy and I came out a patient. That's the part that messes with people. Not because medicine is bad, but because the what-if machine never stops once it starts. And look, I want to be clear. If you're having symptoms, real symptoms, chest pain, sudden weakness, trouble breathing, blood where it shouldn't be, you absolutely go get checked, no hesitation. This is not about ignoring warning signs. This is about something more subtle. It's about the gray zone, the you feel fine but let's check anyway zone. That's where things get complicated. Because modern diagnostics are insanely sensitive now. We can see tiny changes in the body that 20 or 30 years ago would have gone completely unnoticed. And here's the kicker. Not everything we can see is something we need to fix. Some things grow so slowly they never become a problem in your lifetime. Some things stay harmless forever. But once you find them, mycologically, medically, and legally, they often stop being harmless. And now you're in the system. Now, let's talk about something nobody likes admitting out loud. Doctors don't always have time. Not because they don't care, because the system is overloaded. In many places in the US, you get maybe 10, 15 minutes with a physician. That's it. In that time, they're supposed to review history, listen to concerns, order tests, explain risks, document everything, and make decisions that can affect your life for years. That's a lot. So what happens? The safest move in the moment is often test more. Because we didn't test enough is seen as a bigger risk than we tested too much. And that's where patients need to step in. Not in an aggressive way, but in a smart way. You've got to start thinking like this. Is this test solving a problem I actually have or creating a new problem I didn't have before? Let me give you a real-world style example. You go in for a routine scan. They find a tiny nodule somewhere. It's 2 millimeters, too small to characterize. Doctor says, let's monitor it. Okay, cool. But now you're coming back every 6 months. Now you're thinking about it. Now it has a name in your mind. Now it has power. And even if it never changes, it has already changed you. That's something called medical anxiety creation through surveillance. Yeah, that's a mouthful, but it's real. And in the US, where healthcare is highly advanced and highly defensive, it happens more than people realize. Now, let's flip it. Because again, this isn't anti-medicine, this is about balance. There are absolutely times where early detection is life-saving. Colon cancer screening in the right age group can be huge. Blood pressure management, critical. Diabetes monitoring, life-changing. But the mistake people make is assuming more screening always equals more protection. That's not how biology works. Human bodies aren't machines where every abnormal number means immediate failure. Sometimes it's just noise. Now, let me tell you something I've learned from watching real patient stories and real outcomes. The healthiest people in their 60s, 70s, and even 80s are often not the ones who did the most testing. They're often the ones who understood when to test and when not to escalate unnecessarily. They ask better questions. They slow things down. They don't panic at every abnormal number. They say things like, is this something that actually affects my quality of life? What happens if we don't treat this right away? Are we fixing a problem or just reacting to a scan? And that mindset alone changes everything. Because now you're not just a passive patient, you're part of the decision loop. And in the US healthcare system, that matters more than people think. Now, let's talk about fear. Because fear is the silent driver behind a lot of unnecessary medical escalation. Nobody wants to miss something. Doctors don't want to miss it. Patients don't want to miss it. Families definitely don't want to miss it. So everyone leans toward just in case. But just in case is not free. It has a cost. Sometimes that cost is stress. Sometimes it's money. Sometimes it's a procedure you didn't need. And sometimes it's a complication that becomes your new reality. That's why understanding risk versus benefit isn't just medical, it's personal strategy. Now, I want you to imagine something. You're 68, you feel fine. You get offered 3 tests. One test has a high false positive rate but finds everything. One test is moderate but more targeted. One test is only for symptoms. Which do you choose? Most people instinctively go for the most aggressive option because it feels safest. But safest doesn't always mean healthiest. Sometimes the smartest move is selective testing, not maximum testing. That idea alone can change how you navigate healthcare for the rest of your life. Now, here's something I want you to really sit with. A good doctor isn't just someone who finds problems. A great doctor is someone who helps you avoid unnecessary ones too. And a good patient isn't just compliant. A good patient is informed, not paranoid, not dismissive, just aware. Because at the end of the day, your body isn't a checklist of tests. It's your life, your mornings, your independence, your ability to wake up and just live without being attached to machines, reports, and worry loops you didn't have before. So next time someone says, "Let's just run a few tests," you don't have to say no. You just pause and ask one simple question. What are we hoping to learn, and what happens if we find something small? Because that one question, that's where everything changes. That's where fear slows down. That's where clarity starts. And that's where you stop being just a patient and start being a decision maker in your own health. And honestly, in today's world, that might be one of the most important skills you can have.